Katie, could you tell us a little bit about some of the work you do in terms of, helping youth with these types of issues, and even families? I know that you do some work with families as well.
Well, I've worked on college campuses, and I've worked individually and in groups in my private practice, and I think that on call it depends on the location in the country. It depends on if it's a rural area versus a more urban area. So it's really good to hear that there have been some positive experiences locally and that stuff is happening. But I don't think that's necessarily everyone's experience and not every college campus. I think colleges in general tend to attract people from all over the country and a lot of diversity, and I think anytime you have diversity there's also more acceptance
more tolerance.
More tolerance of differences with people. So I've really fought on college campuses where, for example, there wasn't a lot of tolerance, and to create LGBT resources on campuses and educate on dating and coming out, the importance of coming out of the closet, and despite what we're seeing in some of the media that some youth are getting bullied and whatnot, but even kids that are out are getting bullied as well if they seem like they're too girlish or whatever. I think
different sometimes.
Different, yeah. So, but I think from my experience, I try to encourage people to be who they are meant to be, and not be afraid of that, because it does get better. And I think that if you walk that path of knowing who you are and just expressing that, then you're going to go in the right direction, and finding people that are safe, that are supportive, because there are people out there, and there are people that care, and there's people in schools that want to be there and help, and like you said, at the schools that if you went and you talked about needing help or whatever, that there was some. So I think the key is for youth to not feel like they're alone, that no one understands, because there are people that really understand what's going on and want to help. Like for example, I want to help, and I think we need to educate parents, like we're doing with this program, and schools and communities, and just letting everyone know they're not alone. There's help. There are people that care, and that it ultimately does get better.
Well, and I think there's such a varying degree of opinions about the whole issue of the homosexuality, and some people are really just hung up on the morality issues, and there's and then I also think there's sort of this mob mentality, like maybe some of those kids, if you just were one-on-one with them, would be fine with you.
Yeah, there would be a difference in opinion.
But because this sort of everybody's picking on the gay kid or whatever, then
why not just join in and become with the popular crowd, the majority?
And in a sense, the irony is that they're not really being true to who they are,
Everyone's
and yet
getting stigmatized for something.
So it's interesting to me just that there's sort of that dynamic in that all as well, because I would imagine that some of them probably go home and feel bad about it, or that's not really what they wanted to do.
It may be encouraged at home in a way.
Exactly.
I think that I think children and young adults learn from their parents and their families, and if they learn that it's okay to make fun of a kid because of whatever you fill in the blank, that will happen, and they will engage in that behavior.
Yeah, exactly. So I'm just curious, John, how are things going with your parents? If you don't mind me asking. I'm sorry, that may be a little too personal.
It's all right. I'm willing to share for the sake of this program. I guess my parents kicked me out when I turned 18 because they didn't have to, by law, financially support me anymore, and it was kind of difficult. I went through a period of life where beforehand I was most vivacious and gregarious and upbeat person, and my spirit was like renowned at my school and well known throughout, and my parents kicked me out. I guess it all set in that I really wasn't loved, and it really hurt, and my spirit got broken, and people noticed it. I would go to school every day, and
like in your countenance.
Yeah, and I wouldn't smile anymore, and I wouldn't skip around the halls like I used to, and it was a really difficult time for me, and I had to think for myself, and I had to support myself, and it's not a thing that a lot of 18-year-olds have to do. It caused me to grow up quicker and to get some perspectives and attitudes about the world that I think are a blessing now, and I'm just so much more prepared, if anyone does experience all that all that strife, and problems in their youth, then they'll have to learn more than people that just get everything handed to them. So there's an intellectual gain from going through the hardships and pulling something out of it. Therefore, another reason it gets better.
Yeah, great. What a great experience in a way that you've been able to turn that around, really. Yeah. And so how were you able to do it? I mean, like, how were you able to provide for yourself? I'm just curious.
I guess. You mean financially, or
yeah,
do you mean?
Yeah. I mean, all of it, really.
All right. Well, I was lucky enough to have a boyfriend at the time who was, since I was so, I guess the way my like psychological response to everything was that when I got pressured by others and hampered and like pushed down and oppressed, I kind of just exploded like a firework in Katy Perry's great song. And it was something that no matter how much like problems were given to me, I would always bounce back with a better attitude and like smile, and that's just how I worked, and I hold that true to today. And that I don't know if I would be in the positions like of financial stability and of housing and things like that if it wasn't for all those things that I've learned of being able to be graceful under pressure.
It sort of taught you
stuff.
resilience in a way, or built that
Right.
resilience in a sense for you. Yeah, so that's really interesting.
I moved in with my boyfriend when I got kicked out from my parents, and that was good for a while, and then me and my boyfriend broke up, and I couldn't continue to live there. And so I moved in with a teacher, and then I moved in with a couple of people who live in Sacramento and participate in a lot of different community activities.
Wow. So you really got involved
Right.
in your community. So Justin, how about you? How has it all kind of worked for you in that
My
sense?
situation is actually kind of complicated. There's a lot of background. My mother actually couldn't work anymore. She used to work for UC Davis at the Primate Center, and she ended up getting really sick and just being unable to work. She was actually diagnosed with cerebral aneurysms and did pretty much have a stroke. And I almost lost her.
And she's your support. Yeah.
And that was my main support. I actually had to grow up fast myself. Pretty much since elementary school, my mother was a single parent, so she pretty much just worked day and night to try to support us. And that's why kind of the decision to go to school was ultimately
up to you.
mine. And that's why I did miss a lot of class and stuff, because I was trying to avoid the bullying and the just kind of the harassment. But ever since then, I just had to grow up fast. I had to learn how to take care of myself, learn to do things on my own, and just be really independent. As soon as I could start working around the age of 14 and a half or so, that's really when I got in there and just started to work and help support our household. And it was always just me and my mom. She's always been my support, like I said, and she's been there for me the whole time, so I'm always willing to work and help her and just kind of support our home. And all through high school, I just worked. I did a lot of work. I skipped high school a lot, and I actually went on and did community college classes instead of high school.
Yeah, you can do that, actually, remarkably enough, but yeah.
And it was a much better environment for me.
Right, and more accepting.
Yeah. And that was pretty much how I got through.
Right.
I escaped the high school realms, and I went to community college.
Pretty creative there, Justin. Yeah. Well, I'm really impressed with both of your stories. I know that the way that we have the show set up today is that we're going to have you folks, a couple of you leave, and then have a couple more guests come on as well, because we actually have 5 guests. And I think it's just about that time. So thank you both very much for being here and for contributing to this dialogue. And I really hope that it helps some folks that are out there experiencing this. Appreciate it very much.
Thank you.
So I'm going to turn to you, Katie, and ask a couple of questions while we do our little transition here. I know that oftentimes folks will feel some suicidal thoughts and things like that when they're experiencing this, and I'm just wanting to ask you, what we can do, how can we reach out to them, and what kind of things can we help with? And it sounds like both of our youth here have experienced that. They,
Well, I appreciated both of them sharing their stories and hearing about the cutting as well, because I know that wasn't something I mentioned, or self-harm, and that's very common. I think that, the depression and anxiety is so high in LGBT youth, and depression is a precursor for suicidality. And I think so many people, around want to help when they notice someone's depressed or they're acting a little different. They can quite put their finger on what's happening, but there's something going on that's wrong, that's off. So I think it's good to just kind of know some of the signs of suicidality and just know what you can do to help. I would say don't ever be afraid. Number one, first and foremost, is never be afraid if you're a support person or someone in the community or someone who wants to help, to ask them how they're doing. If there's anything, reach out. And connect.
Don't be afraid to ask those tough questions sometimes.
Connect and say, hey, are you feeling depressed? I've noticed you're acting a little different lately. I know that a lot of young people do think about suicide or killing themselves. Has that ever been a thought? These are things, if you figure out that may be going on, have them reach out to local people that are professionals. It could be people in the schools, teachers, school counselors, friends, clergy. whoever in the community you're connected to that may be an adult person or a professional.
And I think it's a little bit hard sometimes, because one of the things we learned about as we were working on our collaborative here in Sacramento County is that many of the youth that had come in for services that were LGBT or Q would say to us, well, my therapist doesn't get this, or they're trying to change me, or they're trying to tell things like this. And it really became very troubling to us as an advocacy agency, because I thought, wait a minute, this shouldn't be going on. And we worked really hard to try to improve some of that and to get some training to folks. So I think there's just a fear sometimes, to whether that, if that's the right person, or are they going to be ignorant or educated about these
that's
these
absolutely
issues,
a fear.
And so I think that's probably what holds some folks back sometimes,
And
so we need good people like you.
Well, and there's local organizations. There's the Gay and Lesbian Center here in Sacramento. There are, in most major cities, there's gay and lesbian centers. There are gay straight alliances on high school campuses. There's resource centers on college centers, and there's the Trevor Project. That's a good website to go to. It's 24 hours a day. They deal with LGBT, suicidality and bullying, and are professionals that know and can understand. So I think the number for the Trevor Project is 866-4U-TREVOR.
Great.
So that's 866-4U-TREVOR.
Great, wonderful. And it's an excellent program, actually. And then there's some hotlines and crisis lines and warm lines and things like that. But I would just encourage folks to reach out to those, just to get connected. Don't isolate. I think that really is one of the biggest things. I think it's hard enough to, be a young adult experiencing depression. There's the stigma involved with mental health issues, and and it's doubly hard, I think, when you are trying to come out. And so it can really be such a kind of a dangerous time in someone's mental health and in their, for their own welfare and safety.
I think the isolation piece is the big one. I think people know that they're not isolated, they're not alone, that there's somebody out there who is going to hear, who's going to understand, who's going to care. I think that in and of itself can be that bridge. That can make all the difference.
Absolutely, I agree. And I do. I think it's so easy to isolate, but those are the things that kind of just make you feel even more alone, So having those places is really important, and I do hope that we continue to expand, programs and services. We do have the Gay Lesbian Center here in Sacramento, but we really need some more, programs and services, a teen center, or youth, a resource center where people can go and get, information and knowledge. Maybe people don't want to be as stigmatizing, but they really don't know and they really don't understand. And I know for myself, just doing some of this work over the years and being part of the collaborative, I've just learned tremendous amounts, and just from people's stories and even here today, and just how important it is that we do provide some kind of safety net. From a mental health perspective, I think it's really important.